My name is Brazeau. If I did not introduce myself when you came in, I apologize. I am the founder and CEO of MPN Advocacy and Education International. Prior to this, which is now 9 years, I was with the MPN Research Foundation in Chicago for almost 9 years. So I've been in this space, believe it or not, for almost 20 years. And when I started, it was right around the time that the JAK2 gene mutation was discovered. So there was lots of action. You know, everybody was so interested, and it was so great. But I can tell you, we have catapulted to this place where so many companies are interested in MPNs, and so many new drugs are in the market and coming down the pipeline. And I've just never seen anything like this in any other disease group. Prior to this, was working in breast cancer and prostate cancer and in education and advocacy. And it's just been an incredible journey for me, not being a patient, but being here for you, the patient. And what I have always done, and I'm a huge proponent of, is to bring everybody together. So that means you as the patient and caregivers, the biopharma companies that are making drugs for you and for this disease and blood cancer, and then our doctors. And I cannot thank all of them enough. I do want to thank our physicians today and researchers. They come here for free. They speak. They take a day away from their patients and their laboratories to be here with you. They're incredible people. They're accessible, they're easy to talk to, they will answer your questions, and you will have plenty of time to ask them questions. They're sitting among you, so take advantage of that. So I want to start with my 20 years of experience with MPNs. And first of all, Dr. Ruben Mesa is our scientific advisor and a frequent speaker at our events, although he's in Israel right now and we're here, although he planned this date. I'm saying that as a joke now because he said, let's go to Boston in November. And I went, Boston in November? Are you kidding me? Let's go to Hawaii. Let's go someplace else. But anyway, but he was taken to another event in Israel, but he's been with me since day one. I'll move right along here. Okay, so after all these years of being in the space, it was evident to me that women had very specific issues with MPNs. And, Alison Moliterno, I don't know if any of you know her from Johns Hopkins, she's a researcher and clinician. She had written a paper a long time ago in the early 2000s about the difference in gender, how they respond to MPNs. And I read that paper and I was struck by it. And and of course getting calls from patients every day and women that were afraid to have babies and women going through menopause and women, all these other issues that we deal with. And so we started a Women in MPN program. We host an event annually. And this next year it'll be we always host it in September, Blood Cancer Awareness Month. And in September we will be in New York City and host that event. It's always well attended and the speakers are fantastic. And so I would encourage you to come if you can. We also are hearing more and more from parents of children with an MPN. And Dr. Razar is sitting here, and you'll hear from her later, but she and Dr. Kusin in New York are actively working in pediatric MPNs and looking at what's happening with children and young adults. And so we started a program that we try to do annually, and we bring the kids together. We try to get the kids together. We have a private chat for them, and do as much as we can to support the parents. We also took on this endeavor several years ago. Dr. Ron Paul, who's with us here today, partnered with us, and it's just been such an enormous task. We have been trying to get MPNs on the Veterans Administration's presumptive list, which presumes their exposure to Agent Orange caused their blood cancer. And it's been incredibly difficult. We've been through how many administrations? 3, I think, since we started this. And we had our chance when the head of the VA was a Vietnam vet and had our blood cancer, and then we lost him. So, we tried very hard, but Dr. Rampal has been with me to meetings in Washington, D.C., and we're just not there yet, unfortunately. There isn't enough science to support our efforts at this point, but we're hoping so someday. And then we have lots of partner initiatives. Many of you are in this room, but we work with every organization that helps MPN patients. So for example, you're gonna hear from a woman today who is very active with the PAN Foundation. And that foundation helps people get their medication. If you can't afford it, call us or you'll hear from her and you'll get her information. But we also have organizations that will drive you to your doctor appointments, that will help you in any way that you may think there's nothing out there for you. There are so many resources now for MPN patients. So, just ask us and we'll try to lead you to those resources. We were involved in a migraine study that has been completed, but we do have the information about that migraine study because we discovered it's mostly with women that in the survey that we sent, and that most of them had ET or PV. And interferon was a great one to kind of end those migraines, the people that went on interferon, but I don't have all the scientific information, but it was a great study and we got a huge response from that. And then we also started to go with the flow, which is food and smoothies that promote blood flow. And it's in the very early stages, trust me, but our videographer, Daryl, who's sitting back there with his son, Ben, he's been with me for 9 years, and he came to my house actually, and we did these videos of, because I try to eat as healthy as possible, and I thought, okay, I'm gonna do this, and it was quite an experience, but it is out there. We're gonna reignite that whole program, and so you can just go to our website or our YouTube channel and find some meals right away and some healthy food. Healthy recipes, there it is. All right, so our goals and commitment are pretty direct and pretty easy. We want to assist you, direct you, inform you, and make you a part of the puzzle. We want to make sure that you are you have a voice. We host a ton of focus groups these days, and they are extremely well attended, and patients want to be part of our focus groups because they get to say what they need to ask and say. Our partners have been involved with that and have learned quite a bit from the patient. We want to provide or make sure that you're getting quality care. We want to make sure that you have access to treatments, and if you don't, you need to contact us or ask your physician, because there are ways to get medicine that you may not think you can afford. We try to update every other month with our research and clinical trials. We try to tell you all what's going on in those areas. Our advocacy efforts I kind of pointed out to you, but we are always available. When Medicare wasn't paying for something, I can't remember now, it's been a couple years, but we were contacted by a group of physicians, hematologists that said, will you help us? And we did. Kathleen Michael, who still is with us part-time if we need her, had been on the Hill for 20 years and she just went after it, and so we were able to help with that. And then again, we have tons of resources available to you, so please use us when you need us. So I'm sure many of you have heard this over and over again. In fact, I think I said it this morning, so I'm so sorry. But you see somebody and you say, you look fantastic, and they're not feeling great. And MPN patients have, extreme fatigue. You may have a migraine. You may have bone pain. And now that we're seeing this much larger group of younger patients, they're still working. And so we've heard from patients saying, I'm so afraid to tell my boss that I have this, because I know I'm not going to get promoted. I know that if I'm not feeling well one day, they're going to say, oh, that's because of this. And, so there's a lot of fear around an there are emotional challenges around your diagnosis. And honestly, we are on the phone constantly with patients and in emails. And when we get a call from a patient, we go sit someplace else and just listen and talk. And we say things that we need to say or direct you to some help. But don't be afraid to call us if you're feeling down one day. And I have to tell you, these physicians are top-notch, and many of them are available also. They might not be able to call you right back, but they will get back to you. There's a lot of fear. Last year, a few of you know this, I was not completely scientifically diagnosed with cancer, but there was a possibility I had cancer, and I will tell you, it threw me for a loop, and I just remember crying all day. And my daughter came to my rescue right away, and I found out I did not have cancer, but I will tell you, for a month, when I thought I did, was miserable. So I can relate to you on some level that hearing that diagnosis, a lot of fear, tremendous fear comes with that. And the great news from my perspective, being this old bag in this scene for so long, I know people that are in their 80s that have had an MPN for probably 40 years. So, most of you are going to live long, productive lives. There's so much uncertainty. Will I be able to afford my medicine? Will I get sick? Will I progress to something else? And those are big, important questions. And it's difficult. It's a very difficult time. But the uncertainty can take you down. And I hope that programs like this, and hearing from these doctors today, and reading literature, keeping yourself educated and on top of this information, is going to help you abundantly. You will be on top of it. Take charge. The financial burden has to be enormous. The medicine is not cheap. And so, again, call us. We will direct you to places where you can get help to get your medicine, okay? And I think Insight and Pharmacentia and some of the other groups here have programs in their companies that can help you. And then the physical limitations. I had a woman in Detroit, Michigan, who was working in a factory, and guess what her job was? She was cleaning tools at this manufacturing company, sticking her arms in benzene, tubs of benzene, and pulling the stuff out. I said, don't you wear gloves? She said, none of us do. And she had PV. And benzene is known to cause a blood cancer. And I was just astounded. And we had this long conversation, and I said, my God, you need to talk to OSHA or somebody and get gloves, wear gloves. But she quit the job. She did end up quitting that job. But there are so many other physical limitations. If you're fatigued that day, as I said earlier, if you wake up with a horrible headache, if you just can't get out of bed, that happens sometimes. And so, there's two schools of thought. Share the information with your boss, so they at least know that you're going to be productive, you're just having a bad day, or don't, but, it's difficult. And you may, some of the patients in here, you've been with me a long time. This young woman over here comes to many of our events, and very knowledgeable. You are so knowledgeable. She is a groupie. I like groupies. Anyway, but there are so many other patients in this room that are so knowledgeable. They've been around the block. They can help you. Talk to them and share stories. So these are the myths that I've heard over the years and discovered over the years, and that is the average age. And probably one of the physicians could speak to this, but Rajit, didn't it used to be like the average age was 60-something, or, it's dropping down considerably. I think now it's just 52, somewhere in there, because more and more people, young people, are being diagnosed. And again, getting back to that idea of, younger people working, having families, and, needing to know more about their disease. Life expectancy has completely changed. I think the average person, when I first started, they would call me and say, oh my God, I was just diagnosed with MF or PV or ET, and my physician said, get my things in order because I probably have 3 years. And I said, oh my God. And that is just not the case. As I said earlier, many of you will live long, long, productive lives. Oops, sorry. And then men and women experience the same issues. Yes, you do. But there's also many other issues that women have to contend with, and men. And that paper, referring back to Alison Moliterno's paper, she discovered in her study that men suffer from here up and women suffer from here below. They have more issues. So that is not true. Planning ahead for surgeries. I remember saying this to a patient, and somebody came behind me and said, they don't have to do that. Oh my God, yes you do. If you have an elective surgery, you need to bring a team of people together. The surgeon, your hematologist, whatever other doctor or specialist is going to be helping you, bring them together before your surgery. Let them know what medications you're taking. Let them know, your hematologist can speak for you probably in this case, but they all need to be aware. I had two anecdotal stories of two people that give a ton of money to these two different institutions, and had surgeries at those institutions. They both had, one had PV, one had MF, and both almost died because they weren't getting their medication for their MPN. So it is absolutely vital that you do that you make sure everybody knows what's going on. And then we have a card that if you don't have one, you should carry with you for that possibility of an accident or something like that. You're in an ER or ED, and the person doesn't know you have an MPN. We have a card that you carry with you that has the kind of MPN you have, the physician's name, the number, how to contact that physician, and what medications you're taking. And then Dr. Messa and I go round and round with this. We both agree. We're not sure it's a orphan disease anymore, but I won't get into that because there are just so many people, more and more people that are being diagnosed. So coping with your diagnosis, take control. And by being here today, you're taking control. You're going to hear as much information as we can give you in a day. Read everything you can read, except make sure it's coming from a viable source. Take care of your body, take care of yourself, and that means getting enough sleep, eating properly, walking. If you can't exercise, heavily, take a walk every day, anything to keep your blood moving and to keep yourself going. If you have a spiritual attachment to something, keep that strong. Keep your family and friends around you. So, let's see, I think I covered all these. And know that you're not alone, because we're here. We will always be here. And so you can find us online at mpnadvocacy.com. We do have Twitter for the moment, but we probably are going to ditch that soon. We ditched our personal ones, but we're in the process. But the sad thing is we have a huge following, and so it's difficult. But, and then we have a YouTube channel, of course. And so with that, these are our partners, and we are grateful to them because we could not be here without them. And you will be seeing a lot of action in drug development. It will continue. There are great drugs on the market now that are really helping MPN patients. So I thank them all very much.